Hey friend, are you asking yourself, is this what I really want to be doing with my life? I don't think so. I think there's something else that I'm meant to be doing. Welcome to the Painting Your Path podcast, where we have real conversations about what it takes to step out, be bold, and do you. I'm your host, Clarissa Castillo-Ramsey. Let's dive in. Welcome back to the Painting Your Path podcast. I'm your host, Clarissa Castillo-Ramsey, and I have one final episode for 2025. And as we close out the year, I wanted to offer a conversation that feels both grounding and necessary. I don't know about you, but this year has been mentally and emotionally challenging. And if there's one thing I've been reminded of again and again, it's that art is not a luxury. It's a form of care. And today's episode comes from the Creative Care Summit Vault and features a powerful conversation with Dr. Tasha Golden. She's a behavioral scientist and former touring musician whose work sits at the intersection of creativity, health, and real-world change. In our conversation, Tasha shares her collaborative Arts on Prescription field guide, a practical roadmap for how healthcare providers, artists, and wellness practitioners can actually integrate the arts into care. Not just theory, but tangible steps that make social prescribing possible. And this conversation feels especially timely as we reflect on what our communities have been through this year, including the Eaton fire and its lasting impact on Altadena, and the Palisade fire impacting that community as well, and so many other events happening worldwide. In moments of collective trauma and rebuilding, creativity becomes a bridge, a way to process grief, restore connection, and imagine what healing can look like together. As we wrap up this season, I also want to share that we'll take a short break. This is the final episode until mid-January 2026, when Season 5 will return with a deeper focus on fire survivors, the organizations supporting them, and the community groups that showed up so powerfully for our neighborhoods. I hope this conversation serves as a reminder that creativity belongs in our healing, individually and collectively, and that care can take on many forms. Thank you so much, dear listener, for being here and for carrying these stories forward. And with that, let's dive into my conversation with Dr. Tasha Golden. Welcome back to the Creative Care Summit. And today I am beyond ecstatic to introduce our next guest. Dr. Tasha Golden has had quite a life journey. She is a touring artist turned behavioral scientist who speaks and consults globally on creativity, well-being, and change. And it's day 5 of the summit, and we're really getting into taking all these wonderful pillars of social prescribing, art, nature, belonging, volunteering, and we want to take it into action. And Tasha Golden is the bridge of bringing
the research into practice. So welcome to the summit, Tasha.
Oh, thank you so much for having me, Clarissa.
Well, I'd like to kick it off just by, your journey is so fascinating. You're a critically acclaimed singer-songwriter who is now at the forefront of research on art and health and well-being. So could you just share a little bit about how your journey unfolded and maybe how your personal short story shapes what you're doing today?
Yeah, this definitely was not the plan when I was out touring for years. That is I from the time I was a little girl, I wanted to write songs and travel and perform them, and I got to do that for a lot of years, worked with amazing musicians, songs and TV and film and things like that. And I loved that work, and I thought that I would be doing it until I died. That was the
Right.
plan. Um, but a couple different things happened that brought me here with you all today. And the first one is that I had songs while I was in my career. I had songs about things like my own history of depression, my family's history of domestic violence, other kinds of challenges. And no matter where we went in the world, those were always the songs that people stayed after concerts wanting to talk about. And they would share their own really personal stories about, mental illness, about suicide ideation, abuse histories. And a lot of them followed up their stories by saying that I was the first person they had ever told. And that was such an honor to me, but it really quickly became a kind of curiosity to me of like, oh, what does that mean? Like, what's happening in the space of music? What is it about a music venue or a singer or a song that makes people's stories speakable for the first time? And the reason that that was interesting to me is that I knew for my own healing and for, what I had read about, healing from trauma and things like that, that it was important to be able to connect with other people, to connect with resources. And so any of the community organizations, for example, that might be designed to help survivors of certain kinds of experiences were clearly not reaching any of these individuals throughout my concerts because they had never talked about this out loud before, right? And I became a little bit worried about that. Like, it's really great that music provides this opportunity. That's part of why we evolved to make music, but also like how do we connect what's possible in the space of music with what's not yet possible in these other really crucial spaces of our lives, like healthcare, also like workplaces, even our homes, right? So that curiosity kind of sank into my bones and lived inside me for a long time. And then the other thing that happened was that the grind and hustle of the music industry uh, drove me into catastrophic burnout and major depression. I wound up being in bed for weeks. I certainly couldn't play shows, and I had to really reimagine who I was and what my future was going to look like if it wasn't this career that I had nurtured and cared about and dreamed about for so long. And in those really dark times, what I kept coming back to was this question of like, why did music and the arts make people able to share things that they weren't sharing otherwise? What does that mean? What is it doing in us and for us? And why, how can we connect that across different spaces of our lives and honor it in different ways and understand it better? Anyway, I wound up pooling on the threads of some of those questions until I wound up with a PhD in public health, specializing in the impacts of creativity and the arts and aesthetics design on our health and well-being, from the individual level, like how we feel, but also as a collective, our systems, our structures, our expectations and norms as a society, how we think humans can and should live. The arts also have impacts on all of those really large aspects of health as well.
Yeah, and I'm so grateful for the work that you're doing because as a lifelong artist, I know firsthand the healing power of art.
Mm.
And you are the lead author of Arts on Prescription. And actually, I have to share this story, quick story too. One of our other speakers in the summit, her name's Amy Cami. She is a healing harpist. And she said, "Oh,
Mm.
she's like, do you know Dr. Golden?" And I said, "I know the name." And she reminded me of Arts on Prescription. And she said, "You have got to get in touch with her." And again, I'm just going to say it again. I'm so grateful that you're here today. And I'd love if we could talk a little bit more about that beautiful field guide. And could you just share an overview of what it is first? for those who don't
Yeah.
know?
Yes. I'm so happy to do that and so happy that you mentioned it. Um, Several years ago, I was asked by some fabulous people in Massachusetts to come help them evaluate the first statewide model of arts on prescription in the US, which was in Massachusetts, kind of spearheaded by the Mass Cultural Council. And we learned so much in that project that it was such a beautiful, like initial model, but it also was across the state, rural and urban. It was like 12 different setups of like, this arts organization with this healthcare facility. And so you got to see, and they were doing it in 12 different ways. You got to see many different ways that this was working. And we learned so much, and we didn't want that learning to only be kind of delivered back to Massachusetts. We were like, how can we ensure that the things that we have learned, kind of being the first to do this in this particular state, how can we kind of analyze and distill our learnings so that they can be broadly applicable to anybody in any community across the US? So we partnered with the University of Florida Center for Arts and Medicine that was also conducting some arts and prescription research around the country, and kind of pooled our findings together to create this field guide. And it is designed to be read by anybody. It is not an academic, like peer-reviewed thing. It is designed to be used. It is like a workhorse document, and it is absolutely free to anybody who wants it. It's like got an absurd number of appendices and resources so that you can dig in as much as you want to, nerd out as much as you want to. It's 120 pages packed of like, just here's what it is, here's how you do it. And we wanted to make it as informative so that you can feel like, oh, I have a robust understanding of this, but also as actionable as we could. So I think we achieved that in making it kind of like, I understand, like when I read this, I understand what this model of care is, what arts and prescription is, and I have some ideas of how I could get started.
That's so great. And on that note, what is maybe one or two like action steps that a clinician, let's start with a clinician who happens to, they're watching this series, they're like, okay, there's something here. Like, where can they start with all of this?
Mm. Well, I think that I would start with kind of where the field guide starts, which is the definition of health. A lot of times, like people are like, oh, if the arts and culture, if nature can benefit health, like maybe let's back up and be like, what the heck is health, And the World Health Organization in the 1940s defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And I always want to pause to acknowledge like what a high bar that is, like complete well-being and not merely the absence of disease or infirmity. And the field guide points out, and I'm often pointing out in my work with clients that, we have gotten kind of good in our understanding of health at talking about that absence side. And a lot of times we kind of get stuck there as a society. Like even if you look up your emojis on your phone, if you look up health, you're going to see a stethoscope, a nurse or something like that. It's sort of like the people who help us avoid things that we don't want or heal from things that are difficult, right? We don't have as much attention on what it is that we do want, what is well-being. And I get to ask people all over the world what well-being means to them, like assuming it's not just the absence of suffering. What is well-being? And as you can imagine, the answers are really diverse, really fascinating, but they do cohere around some themes like, well-being is having a sense of meaning, of purpose, of belonging, being part of something greater than yourself, having something that you're interested in or curious about that sort of pulls you forward, having a sense of hope for the future, having a sense of self-esteem and valuing of the self, having support when things get difficult, like a sense of social connection, being able to access beauty, being able to be creative and have some agency, having influence over things that matter to you. This is a kind of collection of things that people say when you ask them what well-being is. And as soon as you hear those things, you start to realize like, oh, I don't think I don't think that our healthcare system is set up to provide for well-being, right? That's not something that you can go to your local health clinic and take home with you. But these are things that are essential to health. It's literally like a whole half of health. And I've come for myself to define well-being as having a life that you want to participate in and feel like you can. The two parts, you want to and you can. And and so when I think about arts and prescription, what I see is a model of care that is starting to address that well-being half of health that recognizes yes, we can help address the absent side of health, and we need to get much better at that. We don't do as great of a job in the US as we could with our healthcare system in that regard. But part of how we could get better at that is also addressing the well-being side of health. How do we build a healthcare system, but also a community, our systems and structures, our society, so that people have the opportunity to be truly well, to thrive and flourish, not just the absence of things that we don't want. And so, as a
Yes.
first step, when it comes to thinking about arts and prescription, what I would invite clinicians to think about, for example, is how that would change their approach to healthcare, to have a tool in their tool belt where they would be able to address these well-being aspects of their patients' lives and not just the absence part, to be able, and we heard, from some of our early studies that the providers were saying, like, I feel so much better being able to not just tell somebody, cut back on this, or you need to do more of that, but to be able to give them something that they actively want, to be able to address things like loneliness, to be able to address things like people's sense of lacking any kind of purpose, which has an effect on whether they take their medication, whether they follow through on, follow-up visits and things like that. So physicians saying like it is helpful to them, both logistically and also as far as morale, to feel like they can
Yes.
offer these tools and opportunities to their patients to coincide with and help, almost like adjunctive care to help improve the assets that they're already able to offer as fabulous providers.
Yes, thank you so much. And I love in the field guide, there was something, I might butcher this, but I think this is in the 1940s where a doctor prescribed, read this poem,
Mm,
to like read this poem. And that was the prescription. So, yeah, I think the definition of well-being and being an active participant in your health and being able to do it is a great way to define it.
mm,
And okay, so I love the field guide, and we're going to have it available for everyone to take with them from the summit. And we also know that implementation, there's a lag. There's a
yeah.
lag. Um, and before we hit record, I was sharing I live in Los Angeles, which is artistically diverse, culturally diverse. Yet we don't have social prescribing here, to my knowledge. And I wanted to ask you, what's the biggest barrier keeping the arts from health, on the margins of healthcare, and how can we start to move forward?
Mm. Yeah, such an important question. And I kind of have two tiers of an answer for you.
Great.
Like the biggest barrier is always logistics. Like people, to be honest with you, Clarissa, I have never talked with a physician or even like a policymaker or somebody else who didn't think that this was a pretty good idea. There's various levels of interest and enthusiasm, but like it's a pretty intuitive thing. But where people kind
Right.
of like hesitate or hold back is that they don't know, but like how would we do it and how would we pay for it? And the logistics are really different. In the US, our healthcare systems are fragmented and everybody's kind of like doing things in different ways. They have different systems that they use, electronic medical records, and all these kinds of things can differ from place to place. And there's a lot of questions around, well, how do you actually do it? And it's important to, in the field guide, we also like an important takeaway is that this isn't a novel, new, weird idea. Like to your
Right.
point, doctors have been for a long time recommending, advising different things that they happen to know about. Like, oh, I actually recognize this one thing in our community that could help you. The difference between that kind of thing that's been going on for a long time, as well as our like systematized processes where like lots of healthcare providers are able to refer people to support groups in the community or to housing assistance or things like that. We do have systems of referral out into the community. So even that isn't unusual. We just haven't yet connected arts into those systematic referral processes. And we haven't yet connected, a given physician who might know of like a local art program that they can refer this one specific patient to that they know would like it. There's a way that you can take that and scale it by creating a system and a menu of options that can be tailored to different patients, and that one single physician wouldn't have to know about all of those options themselves. There can be a system for that. But um, nevertheless, what I was going to get at is that we don't always know what the system is going to be. How are you going to make this referral? How are people going to, how would you find out if somebody completed their referral? Does that get sent back to the physician so that they know that the person went through with it, and how is that evaluated? How do we know how it affected people's health? And then, of course, how are we going to pay for this? And the benefit of where we are right now, as far as the research goes in arts and prescription, and a possible silver lining of our fragmented system of care in the US, is that we are seeing lots of different people do this in lots of different, very different settings, from a university like Stanford to a really rural location to something that's specific for veterans to something that's really specific for older adults. Lots of different types of facilities and things like that. So we have a lot of different models to look at and be like, how did they do it? What worked? We don't yet have something. And I don't know if it's possible to have something that's just like, if you want to logistically do this and fund this, here's how you can do it, because it's going to depend on the specific facilities and opportunities, what's available in LA and how you would set up that system is just fundamentally going to be different than a rural community in North Dakota. And that's great, actually. It's good for that to be customized, but that does mean it's not as easy as just saying, here's how we do it. And the other tier of my response to like, what is the barrier here, is to think from a public health perspective and just from a sort of societal perspective, that we as a society don't yet value that aspect of well-being. We live in a society where we can't even make sure that a pregnant person can have maternity leave and get their job back when they have their baby, or they have to come back after a week of healing time in order to keep their job. We live in a society where we can't even guarantee that people have childcare and education and things like that. So it's not really surprising that we also live in a society where it can be difficult to think about valuing people's experience of arts and culture and nature in their community. And it requires us to shift from a kind of conception of health and healthcare as like a version of robot tune-up. Like
Right.
humans getting treated like robots. We're here to be productive, and productive in a really particular sense. Like, how can you make people more money, right? And sometimes that robot needs a tune-up, or sometimes something breaks and they need to be fixed, but overall they're robots. And there's a fundamental difference between that approach to healthcare and what it means to help humans be well, and the approach to like actually treating them as humans and recognizing the need for flourishing, the value of flourishing, the way in which flourishing and thriving actually helps support those other aspects of tune-ups and fixes, right? It's just a fundamental shift. And I share that because a lot of times people who are, especially in the arts or in arts advocacy, are like, oh man, the arts are defunded, the arts aren't valued, they're treated like the superfluous thing. It's just entertainment or whatever. And that's absolutely true. But I also find it helpful to remind us that, art is not unique in its devaluation. It's a part of a devaluation of humanity and human being and flourishing. And that means that we can find a lot of camaraderie and a lot of help by seeing this work in arts and prescription and arts and health more generally as part of a larger effort to help us get better at treating humans as humans and recognizing that that's actually better for society as a whole, including economically.
Yes. I'm hoping with this summit that we're bringing more awareness to this topic. So thank you again for all of your work. And as you were talking I was thinking about just different communities, and equity and inclusion is something that you talk a lot about. How can we make it so that arts on prescription is accessible to those who might need it most, not just those with resources?
Yeah, this is such an important, thank you for mentioning this, such an important core of the work as we've tried to lay it out, and my partners and colleagues in this work. I think the most fundamental, maybe the easiest takeaway that I can give as an answer to this question is to ensure that the people who are intended to benefit from the arts on prescription model are the people who are leading it, who are co-creating it. And understanding, arts and prescription in general is intended to help ensure that people do have access to arts and culture and things like that. A lot of times if people have a lot of resources, and by resources I mean a lot of money, but also a lot of time, a lot of opportunity to explore and things like that, those people often are intuitively tapping into some of these things for their well-being. They are taking time to go to a music concert. They are taking time to get to learn how to make pottery or blow glass or something like that. They're kind of exploring in their world how these things can maybe help their mental health. Not always, but once they find out that maybe that could be a path for them, they have the means to pursue it, right? So a lot of arts and prescription is about making a kind of more meaningful, explicit connection for people, that they come in for a specific complaint or condition or concern or need that they might have. And somebody can tell them, like, oh, did you know that one of the ways that you could help address this is via this arts or culture or nature intervention? And they might not have known that. So then they have this opportunity to do that. And then also, of course, to help address the lack of access, so that lack of financial access. I think we could do a lot more exploration about how we get more time access. If people are working 3 hours, I mean, 3 jobs just to pay their
Right.
rent, then even if they get a free admission to some kind of wonderful arts opportunity, how are they going to take that up, with regularity and sustainably? So I think we have some imaginative work that we need to do
Yes.
collectively to figure that out. But ensuring that there's equity always comes back to who's at the table, who's leading it, how are we defining culture, and who gets to have a voice in that. A lot of times there's a kind of inadvertent assumption that a community that's been historically marginalized from experiences like maybe a symphony or opera therefore doesn't have culture, and culture needs to be taken to them. And it's sort of like, let's make sure that we are honoring all of the diverse forms of culture that arise even among very oppressed communities. We see this in the origins of like the blues and hip hop, and the oppressed
Right.
communities have created some of the most amazing culture that we still all benefit from now. But it's a matter of making sure that they have opportunity to invest in that, to cultivate it, to preserve it, to sustain it, to grow it, to explore it however they might need or want to for their well-being, and how we can make sure that they are at the lead of efforts to improve their health. So I think that sometimes when we
Yes.
see um, efforts that aren't as equitable or efforts that really just aren't as effective, it's when maybe somebody has had an idea of like, well, I love, it could be like me, I love songwriting and I think everybody should songwrite. And so I take my songwriting program into like a community that I know might have some health disparities or some health needs, and that's not what they're looking for. And I'm not maybe the best person to be offering it there. So it's really paying attention to how can we ensure that the culture and the voices and the leadership of the people that are the intended beneficiaries of a program like this are at the helm of the program.
And part of the conversation. Thank you. And that kind of takes me to a more personal project that I'm doing. So I live in Altadena, which the Eaton fire hit our community. And actually, at the time of this recording, there is a huge grant that's being put out on wellness.
Mm,
And um, I'm planning, I'm gonna go for it. And I do have some art related coaching, well-being related programs. And I'm definitely going to use arts on prescription as, a guide for me. But I'm just curious if you would have, and this is also for the practitioners who are watching this. In addition to reading the guide, is there a step that we can take right now that could help us get our work out into the community that
mhm.
we want to support?
Yeah. Oh, thank you for the work that you're doing, and for recognizing and honoring that sense of loss and need there, and being open to exploring all the different creative ways, innovative ways that it could be addressed and needs to be addressed in order to hit home for a lot of different people. Um, the first thing that comes to mind, well, I have a free ebook that I'll make sure that you have a link
Oh, thank
to,
you.
that's about arts and health. But part of it is to help people recognize the different ways that arts can impact health at different levels. So, I now use the acronym IDEAS. This is not in the ebook, but the ebook lays it out pretty simply too. But, the arts can have an impact at the individual level, individual and interpersonal benefits. If you feel different, can address symptoms, help you heal, things like that. But art can also improve data. In my story at the beginning, where people shared things in the context of music that they weren't sharing otherwise, that means that in those moments, I literally knew more about some of these populations and their experiences than their providers, their healthcare providers did, than their social workers did. And as a researcher, I have utilized arts-based methods to learn from communities, and it enhances the typical conventional quantitative data that we have from these communities. So when people are engaging with communities, like you would like to do, it's a worthy question to wonder, what might we be able to learn from these communities that can help us serve them, not only as a practitioner, but also at the policy level. How can this be an opportunity to amplify voices and amplify experiences and literally supplement public health data? So that's I and D. The EA is for education and awareness. Arts-based programs can enhance what we know about a given issue, how aware people are of it, and that can be incredibly important for lots of different reasons, I'm sure listeners and viewers can imagine. And the S is for sociopolitical change, that an arts-based program can always aim both for that individual level change and for what would have to happen at the local municipal level, state level, federal level, policy-wise, and other kinds of systems and institutional situations. What would have to happen in order to improve people's lives now and sustainably? And how can the art program that we're doing have impact at all of these 4 levels? Even if you feel especially driven to that I level, that initial direct benefits level, how might this be able to expand and offer even more, like even greater impact and longer term change? And I'll just to assure any practitioner who's listening, this typically doesn't take more labor or time or resources than just choosing one level of impact. It's usually possible to do more. It's more about imagination and just thinking about it than it is about resources. So that's the first thing that I would say. And the other thing is to, the field guide can illuminate this as well, but you can start really small. A lot of times when I talk about arts and prescription with audiences, they are imagining the entire like Massachusetts program, or like all of LA and all of the different healthcare systems and hospitals would be involved in something, as one example for your city. But a lot of the models that we have seen started with literally one arts program partnering with one provider. And it could have been a provider that they knew personally, or a provider that had expressed interest in their particular art form before. And they decided to initiate something where that provider became able to refer people to that specific art program. And so not all of that provider's patients, that wasn't always relevant because it was only the one option, right? Or it might only have benefits that are, needed or wanted by certain patients, right? But the point wasn't to be able to be all things to all people, but to start something. And a lot of times what I've seen in my work is that people's willingness to start small ripples out because other people hear about it. They're like, oh, hang on, what? You're referring your patients to that program? I want to refer my patients to that program. Or hang on, I love referring my patients to that program, but I wish that my other patients had something that like hits this need for them. I wonder if there's another art or nature program around here that could maybe do that. And it starts to expand that way. So be willing, I guess this is the takeaway, be willing to start small and, don't put the perfect and don't elevate the perfect and scalable over the fabulous and doable right now.
Yes, thank you.
Mm-hmm.
Yes, because sometimes when I think about this, yes, I want to impact my entire community, and you have to start somewhere. So thank you so much for that. And as we start to wrap up, I just want to leave it open to you, Tasha. What have we not talked about that you would like to share with the audience?
Oh, thank you for asking. I think the general thing is that I often see, because I come from a public health background versus a healthcare background, I have always seen the arts and prescription model as fascinating because of what it does and because of what it illuminates. And there's a lot of hope in that for me. And I don't think anybody who knows me would accuse me of being like an optimist, but I do have a lot of hope in where I see, the possibility of innovation, where I see the possibility of change. And arts and prescription is worthy of note, not just because of how it can change healthcare and help people to have access not only to that absence of disease, but the presence of well-being. And of course, it does help with the absence of disease. We've seen it support symptom reduction and decrease pain and shorten healing times. All those kinds of things are so important. So it can have that effect on improving healthcare and expanding our understanding of what health is and includes to the betterment of everybody involved. But it also shows us that it's possible to reimagine even our most entrenched systems like healthcare, to say like, hey, healthcare isn't everything that needs to be in that we want it to be, and we can choose to shift that, and we can choose to shift that in big ways, and we can choose to shift that in small, really hyper local ways, like one partnership at a time, one collaboration at a time. And then I would also, just remind folks that this is part of an overarching aim to improve people's well-being and quality of life in general, the aim of human flourishing, that aim again of understanding humans as humans versus as robots who sometimes need a tune-up, right? That like, how do we humanize our healthcare system? And also, how do we humanize our other systems? And how can we recognize the little inroads that we're able to make with something like, with a model of care like arts and prescription, which seems so intuitive to people and can work so well. It's just a matter of like getting over some logistical humps a lot of the time. How can we see that as part of our larger effort and our larger imagination of like, okay, what else, how else can we build a community in which it's more and more possible for more and more people to truly thrive? It is possible, we can do it. And you start someplace. This is a way to start.
Yes, thank you so much. And thank you for your time and sharing your wisdom with us today.
Thank you so much for having me, Clarissa. And thank you all for listening.
Yes. And as I like to say, what's your biggest takeaway? Let's connect over in the private Facebook group and share what you're going to take forward. And I'll see you next time. Bye for now.
Thank you so much for staying till the very end. If you found this episode helpful, please share it with a friend. If you haven't had a chance yet, please write a review and rate the show. I would love to hear your feedback. And I also have a free resource guide for anybody who is asking themselves, am I on the right path for myself now? Or is there something else that I really want to do? Maybe you're in that quandary. Maybe you're wondering what's next. So head over to the show notes and you'll see my Painting Your Path framework guide. Download it and have some fun. Just start exploring. And thank you again for tuning in, and I will see you next week.